everyone, and welcome to the Homepage Network. I'm John Vogt. Today on Homepage, we have assembled a group of medical experts to answer some of your questions regarding COVID-19 and how it will impact Tioga County. And Commissioner Roger Bunn is with me to help co-host this broadcast. Roger, good to have you here.
Thank you, John. It's good to be here.
And I'll let Roger do the introductions.
Thank you, John. On behalf of the Tioga County Commissioners, Eric Guelig, Mark Hamilton, and myself, I want to thank you for the opportunity to share, in part, the steps being taken to address the COVID-19 virus pandemic here in Tioga County. This week, the Commissioners convened via teleconferencing a team from across the county, representing the County Emergency Center, boroughs and townships, the medical profession, education, businesses, and others. Our objective is to get firsthand, timely information on this issue. From this team, we formed a task force comprised of doctors, health administrators, county emergency services personnel, and the county commissioners. With us today are Dr. Guelig, Laurel Family Medicine, Dr. Clark, Laurel Pediatrician, Mr. Jim Nobles, President and CEO, North Penn Comprehensive Health Services, and the Laurel Health Centers. Thank you.
Thank you, Roger. Doctors, thank you all for being here today. Now, we have some tough questions that we like to ask you, but I think it's important that we do this because we're trying to bring down the fear and anxiety. And some of these questions, people just want to know. And you're the best group of folks I know to give us the right answers. So, one question, Jim, this is probably for you. What are you doing to prepare for the COVID-19 virus here in Tioga County? And at this point, do you feel confident that we're ready?
Yeah, John, I really do. I think it was very proactive of the county commissioners to declare a state of emergency as they had earlier this week. And with that opened up some funding opportunities. It also gave us the opportunity to stand up this COVID-19 task force, which I feel is going to be so important to bring health professionals, administrative personnel, and really representation across the health systems from Guthrie, from UPMC Wellsboro, and from Laurel Health, as well as having county emergency management personnel come together as a task force to advise the commissioners on this very troubling issue. We know there's a crisis going to outbreak in this county. We want to be prepared for that, and I think we've taken the necessary steps to help mitigate the process and make sure we're well prepared if and when we have our first confirmed case in Tioga County. And I want to point out to the viewers, we don't have any confirmed cases at this time. The source of truth document that we look at is the Pennsylvania State Department of Health. We continually monitor that for the progress as this disease continues to grow throughout the state. But at this time, we have no confirmed cases in Tioga County.
If another area gets hit with COVID-19, and there's an overflow, and they need places to put folks, could we be asked to handle those patients? And if that's the case, will it be a problem for you?
So we don't know the extent that this is going to impact Tioga County and our region. We're preparing for the worst and we're hoping for the best. And we're preparing every day, the many conference calls that we have, the panels that we brought together, the task force that we brought together. So we are prepared to handle this outbreak. If we're called upon to assist another county, that's one of the things that Tioga County is known for. Laurel Health System will definitely rise to the challenge. Guthrie is in this area as well, as is UPMC Wellsboro. And all three entities are going to work very closely together to combat this in our region and the surrounding areas if necessary. But I think if we have some concerns, there may be, we're going to focus centrally on this. We're going to make sure our county is taken care of, but we certainly would not turn our backs on any other counties if they need assistance. We've got the other UPMC facility in the next county over, Charles Cole. Guthrie has a hospital in, many hospitals in Bradford County. So I think we're well positioned to tap into the resources in this north central area for assistance.
Okay, great. Doctors, is COVID-19 always accompanied by a fever?
Yeah, let me try to answer that question. It's not a simple question in that the evolution of the disease or the outbreak is going to have different stages. So in the incubation stage, there may not be fever. the virus is replicating after it's entered the body. Once the disease really takes hold and your body is infected, then your immune response will respond by producing fever. So the answer to your question is, once the disease is established, fever will be present. There's 3 criteria for COVID-19 screening right now through the health department. Fever, the presence of fever, the presence of a cough, which is non-productive, not producing phlegm or sputum, and thirdly, the perceived shortness of breath on the part of the patient. Those 3 are clinical criteria for looking at risk and consideration of COVID-19 screening.
Okay, another medical question, doctors. We hear about shortness of breath. Is this because the lungs are filling up with fluid, or is there something else at play?
The infection, as Dr. Guelig pointed out, when it's in its incubation period, does not have much in the way of symptoms. As it progresses, it causes inflammation in the lung, and that inflammation can cause irritation to the lung and some symptom of shortness of breath for a patient. But the key here is that shouldn't be minimized, because that shortness of breath can also be from fluid accumulating in the lung and pneumonia. So it's a very important symptom not to be minimized.
Both of you mentioned that there's an incubation period before the fever, before the shortness of breath and the different symptoms. Is there something we can be doing on a regular basis to fend us from this disease to begin with?
Yeah, that's an excellent question, and that's really what our focus in this county is. We don't have confirmed cases present, so we have to prevent the spread of disease when and if it comes. So your question is, what can we do? We can do, social distancing and limiting our contact, limiting our travel, not congregating in large groups, whether you define that as groups of 10, groups of 50, closing activities that are likely to spread the disease rapidly, schools, functions, activities, concerts, sporting events. So that's what we can do collectively. Individually, it's complying with those guidelines and restrictions. But you're right, you are not going to necessarily know you're infected, and you're not going to be symptomatic in the early stages of the disease.
So another follow-up to that, let's say you're traveling. You travel out of our area here in Tioga County. You go someplace where there have been known cases. Right. And you come back and you have some sniffles. You don't feel that bad. Maybe a runny nose or something like that. You could be in incubation. You don't know if you have it or not. And you have grandma living with you. What do you do? Now, just to kind of to tag that, some of the follow-up anxiety that we've heard is people say, that's why I need a test now, so I know if I can go home, or do we quarantine grandma in the bedroom, or what do we do? I don't know if I'm in incubation or not. What do we do?
The best thing to do is to be as conservative as we possibly can be. So in that situation, that's exactly what you do. Okay, we don't have the capacity at the present time to be able to test everyone that might need a test. So the safest thing to do for grandma is to isolate, is to self-isolate, and to make sure that we don't have the possibility of spreading that. Okay.
Can I add something to that?
Yeah, go ahead, Doc.
In addition to isolation, which is the most basic and fundamental thing that we can do behaviorally, is meticulous hand washing, frequent hand washing, and keeping our environment clear of potential virus. Because we know this virus it's now looking like a 3-day shelf life, if you will, on surfaces. Varies by the surface. So cleaning countertops, laptops, things, cell phones. There's just a lot of advice and guidelines coming out about keeping our environment clear of virus. Right.
So in that scenario I just mentioned, you come back home, you don't go near grandma for a while.
That's exactly right.
And you'd be very careful around her because you've been traveling.
And we need to balance, don't we? We're social beings. We can't put people in closets and say in 3 weeks you'll be safe. So this is a balance. We need to be social, but we need to be with family, with loved ones. We need to care for the grandmothers. But so you can't be extreme and zealous about this, but you need to be practical to the extent possible. We know that this virus, for instance, is aerosolized and has a distance capability of about 6 feet when a person who's infected coughs or sneezes. That's the basis to the 6-foot social distancing rule. We can really impact the spread of this virus if we just stick with that one guideline. So it's common sense and it's prudence.
Prudence, careful, being careful.
Being careful. Sarah?
Well, doctors, I'm wondering, is there something we can do proactively about our own health? Eating healthy, hydrating. Is there anything like that that would help our immune system to be stronger in this situation?
Well, any time your system is trying to fight off an infection, making sure that we eat well, we sleep well, those types of things are keys to making sure that our bodies can fight off that infection. That's good, practical, sensible things to do. In addition to that, we need to be, all the more vigilant about the things that Dr. Guelig was mentioning as well. That's an add-on. So.
Go ahead, Doctor.
Your question is a good one too, in that we know statistically that people who have underlying disease who are not healthy have a poorer prognosis when infected with this. The people who do best seem to be young, healthy people. So that speaks to your question that the best thing we can do to cope with this illness is to maintain our health through nutrition and
getting enough sleep.
Exercise and all the things. Really, and I even think stress has a role here. I think it's unhealthy for our immune systems to be chronically stressed.
Definitely.
And to engage in behaviors maybe that we know are not healthy for us when we're stressed. Overeating, lack of exercise, worry, poor sleep. Does that impact the immune system's ability to fight infection? We certainly think so.
Yes.
So again, common sense measures like maintain your health in anticipation of an epidemic that we're all going to have to deal with is just common sense.
Another question regarding incubation period. They say incubation is between 2 and 14 days. Do they know why that there's the discrepancy? Why is it 2 to 14 days? Why wouldn't the incubation period just be, 5 days, this is going to happen? Why is that?
I think the best thing you can say is that we don't know. Okay, there's much smarter minds than any of ours that are working on that. Okay, but the best answer that I think we can give folks on that area is that it probably has things to do with the answers to the questions we just answered. Okay, which is the body that it's infecting. So if your body is able to fight, you're going to have perhaps a longer incubation period. Okay, it may give up at the end. But
that's good. I would love it to give up in the end. Wouldn't we, doctor? We would love that to give up at the end.
But if if you have some chronic pre-existing conditions, those types of things, it could devastate you in a very short period of time.
Okay. Johanna, I believe you have some questions on behalf of the younger members of our audience.
Sure. A lot of students my age have this mindset of, I'm young, I'm not vulnerable. What is the danger in that?
The danger in that is that we become complacent, okay? And from the pediatric side, we have to be very careful about the fact that we know that the vast majority of younger people are not going to get particularly sick with this.
Sure.
Those people are going to be the vectors, the transmitters of the virus to the susceptible population. I had folks in my office recently that were saying, well, we were going to get a small get-together next weekend for a child's birthday party. Do you think that's okay? And I was like, no. Social gatherings of any type, regardless of your age, is not indicated at this point. They say 10 people. Well, how about 0? That's a much better, safer place to be. So we have to be cautious that we're going to get a pool of this illness in people who aren't that sick, and it's going to run rampant.
And spring break is a huge thing. Students are just going anyways. What are your thoughts on that?
Our thoughts on that are, it is not a good idea. Okay, I want to refer some folks to a video that recently came out within the last 48 hours from some folks in Italy. Okay, everyone should watch this. It's available, easily found on the internet. And these people chronicalized the situation in Italy from the time a couple months ago. And they were where we are a couple of months ago. And they said basically the upshot of this is, if you want to be where we are now, do what you're doing. And we're doing that, and this is not good.
I would like to just put a little bit of a perspective on what we're dealing with here. Most illness and most disease and most health problems in our individualistic society are the individual's problem. Maybe it extends to family, but for the first time we're dealing with an epidemic, a pandemic. Most of us have never experienced this before. And that changes the dynamics completely when the ability to cope with this requires a collective effort. And I would wager the young generation has a very keen sense of social responsibility. This is their future. This is their country. It's not about individuals. So we really need to start thinking about this as there's a social responsibility. We are all in this together. The disease is going to spread in a social way, and it's going to be contained through changes in social behavior. So it's really unique. It's like nothing this society has ever dealt with before. So that, I would say, to your question, we need to think about not just how does it impact me? Am I young, vibrant, safe to go to a group gathering where I might contract this virus? But what does it mean when I bring it back to my dorm and it brings it back to the parents of these college students who then transmit it to coworkers and grandparents and people who have a higher morbidity and mortality.
And as you were saying, I think a lot of students don't even know if they're carrying this. They're asymptomatic carriers. What do you think is best for them to do? They're going to spring break, they're going to college campuses. What are the best actions for them to take?
The best action for them to take, again, following the CDC guidelines, is when they return home, is that they self-quarantine for 14 days. That is the best thing that they can do. If we look at the person that I think Ed and I and other medical professionals look to for our guidance is Dr. Anthony Fauci, who's now front and center on everybody's front page. And one of the most telling graphics that he's put forth is the peak of the incidence of the illness in Italy. And what he's saying to us is that we don't want this peak. We want this peak. He's saying we will have a peak. This is going to be ugly. This is going to be nasty. But we want our peak down here, not up here. And how we get down here is what we do now. That's the important thing. The social isolation, those types of things, the things that we're asking people to do now voluntarily many times. But that's what's going to keep this from being up here.
And taking it a step further about flattening the curve is the term many people have heard, is simply to spread out the transmission of the epidemic such that we don't overwhelm our capacity to care for the sickest of the people. And that's where healthcare, we really are having to prepare for those worst case scenarios where our capacity is stretched to its limits. We've never experienced that in this country. We've never had so much disease that we are having to question, do we have enough resources? Do we have enough personnel and, you know, medicines and facility to deal with the sickest of our people? So that's the whole idea of slowing the progression and flattening out that epidemic curve that you're talking about through behavioral changes.
And I want to go, I want to answer this in perhaps a little harsher terms. In my opinion, it's socially irresponsible for the younger generation not to take this very seriously. And I understand when you're young, we were all there once, and you're very healthy, and we're not seeing the full effects of this yet in this country to the point in other nations have seen, Italy and China. So it is socially irresponsible when you see what's going on down in Florida, the spring break people, they're not observing any social distancing whatsoever. They're shoulder to shoulder right there on the beach. They're sharing beer bottles. They're tapping each other on the back. They're high-fiving. They're doing all the things we're not supposed to do. And as the physicians pointed out, when they return home, when they're carriers of this disease and their body's natural immune response can fight this off, and maybe they get a fever for a couple days, or maybe they don't feel good, and then they bounce back relatively quickly, that's fine. But when they start transmitting that to the elderly population, and as Dr. Guelig pointed out, we can quickly be overwhelmed in the healthcare sector. And that's what we're really trying to prevent here in Tioga County. And I can't urge the population enough. We have to take this seriously and observe that social distancing.
Right. There's this meme going around that is like, your grandfather was asked to go to war and you're asked to sit on the couch. Surely you can do that, you know?
That's, yes. Yeah, I think that's very well stated.
And taking one step further, I mean, one of the things that we look at is, from my side as a pediatrician, okay, we look at, and most of the press, granted, and justifiably at this point, is focused on the elderly. They seem to be the folks that are getting the most. But the other end of this age spectrum is also at risk. We got to keep in mind that you know, in the state of Pennsylvania now, I don't have today's statistics, but yesterday's, we have a half a dozen, maybe 10 confirmed cases in children in the state. And the children are also at risk. They can get very serious illness if they have pre-existing or underlying conditions, cystic fibrosis or other respiratory tract problems, bad asthma, babies with bronchopulmonary dysplasia, these types of chronic lung conditions, they're at risk just like the elderly. And you know, we're going to see issues there and deaths.
Speaking of the elderly, this next question, if I were to contract COVID-19 and I'm over 70, can I beat it at home, or won't that be possible?
Oh, of course it's possible.
That's good. That's encouraging, right,
So-
Roger?
Yeah, it's very encouraging.
I'm not far behind you guys. So these numbers don't mean anything in and of themselves. It's the older person tends to have a less robust immune system, less capability to fight off these infections. The infection can become overwhelming and fulminant, and many older people have underlying disease. You know, the number of 75-year-old people that have stable coronary artery disease or have an element of emphysema or lung disease, those people are at much higher risk, much higher. So the age isn't the only thing. It's the other conditions that go with aging.
But this is a misnomer that if you're in your 70s or 80s, you're toast.
Right.
You can fight it. You could beat it at home.
Yes.
If you need medical attention, if you do need medical attention, Jim, what do they do? Where do they go?
Yeah, I think that's very important. We talked about that in an earlier segment. It's very important. Please call your healthcare provider. Call your physician's office. Contact your healthcare provider and let them know what your problem is. They're there to help you. They'll talk you through the process. We can't over inundate the system with people just showing up on their door. We're opening up and we're advancing our telehealth capabilities at a monumental pace, something this country has never done before. We've removed some of the bipartisan concerns in the Congress, and we're advancing telehealth opportunities. So there's going to be opportunities for your physician to take care of you at home, but you have to call that office first and let them know what your symptoms are, and then they will advise you necessarily where to go. Come into the doctor's office, or in worst case scenario, if you're severely ill and you're having major respiratory issues, activate the EMS system, call 911, and they'll take you to the hospital. But we can't have everybody just showing up on the doorstep of our doctor's office or the emergency department if they just feel a little sick and want to be tested or err on the side of caution.
And I'd like to add one thing to that. That's a segue into something that I wanted to bring to this discussion today, was that when you contact your doctor's office, we have a protocol to go through some questions that we want to ask. And we need to ask those questions. You need to answer them honestly, because that tells us how do we take care of you. And when we ask you to come to the office at 2 o'clock, don't show up at 1 o'clock. Our offices are stratified so that we keep patients separate. So we're not having a lot of people sitting in the office, in the waiting room, waiting to be seen. We want to move those people into exam rooms to keep people separated. So getting there early isn't going to get you seen earlier. It's going to make you more potentially either infected or infectious, one of the two. So follow the protocol from the office. They've got a very specific mandate from the front office all the way through the providers to take care of you, and we'll take care of you. But we need your cooperation there too.
Right. Sarah?
How are you protecting your healthcare staff?
It's a really critical question. And we had a staff meeting this morning, and I made the point, and we all agreed, the most important thing to do is preserve our workforce, take care of each other. And your question is an excellent one. If even a handful of our providers goes down with a fever, they must leave and not work. And if they test positive, they're out for 14 days to prevent infecting our patients. So when you think about that, the number of patients that are not going to have access to a clinical provider if just one provider is sick. So we need to maintain standards of hand washing, gloves, masking, respirators, just hygiene. Hand washing before and after every patient is critical. And we just stressed upon it ourselves at the table this morning. We must be diligent about self-care and care of each other's so that we have a full workforce going into the intense portion of a potential epidemic.
So that fits somewhat into what I was saying earlier as well, that if you call, we're going to screen your phone call. And if that screening produces or if a positive response, or if that screening at the front desk produces a positive response, we have a protocol for which to isolate the patient both from the other patients in the room, in the office, as well as what the staff does to protect themselves from that patient. So the protective gear that Ed was discussing, that stuff is activated, it's available, it's ready. We need to know who that we need to work with that. Okay, so that's important for the families and the patients to let us know that information so that we can protect them, the other patients, and ourselves.
And there's another great point. So many times in the healthcare system, we encourage people to bring family members along with them to their visit. That's important as we ask questions of our physician. Having 4 or 5 or 6 ears there to listen to the response is very important. We need to limit that. If you can travel to the office by yourself, please do so. If you need someone to take you there, that's fine. They can help you out of the vehicle. They can get you into the office, but then we're going to ask them to return to the vehicle and limit the exposure within our waiting rooms. And the way we dispense care moving forward, as this continues to grow throughout the country, it's going to change dramatically as well. We're not going to see people sitting in waiting rooms waiting to go back into their visit. You may come in. If you're infectious, we're going to mask you appropriately, and then we may ask you to wait outside in your car, in your vehicle, and then we'll call you back in when it's time for you to go back into the exam room. And that's an important part of that social distancing. Many of our health centers have congested waiting rooms, and we have to maintain our diligence as well. And if we're asking the public to maintain proper 6 feet social distancing, we can't have people sitting next to each other in the waiting rooms. So we may ask you to return to your vehicle, and we'll call you in, or we may just walk you right back through the check-in process right into the exam room. But that's to Dr. Clark's point, the importance of maintaining that schedule. If you're seen at 2 o'clock, you show up at a couple minutes before 2 o'clock, we get you checked in and right back into the exam room to limit that exposure, because we also have to care for our caregivers as well. And that's something that's very concerning to me. As the president of the system, I have to keep an eye on this on a daily basis. How many of our staff do we have that are sick? How many of our staff do we have that are out? And are we going to have the necessary resources to be able to care for that? We're good right now, and we're very prepared as a county, but as this continues to infect us, there may come a time when the staff members are going to be out, and we have to really make some tough decisions how we're going to bring in additional staff.
Sometimes people are being frustrated because they can't get testing. What is your protocols for that?
Yeah, that's a great question. I know that's something that's on the mind of everybody. You know, when do I need to be tested? Should we be testing everybody in advance to get ahead of this? And I'm going to turn it over to our physicians here in a minute. But I just want everybody to understand we do have the capability to test patients in Tioga County. What we don't have the capability of is to do testing within a Tioga County laboratory. So if a patient meets the criteria that Dr. Guelig mentioned earlier, and we'll reiterate that again, if patients meet the criteria, the sample is taken here locally, and then we ship that off to an off-site laboratory. The test is run, and then the results are returned back to us. And as I said, to date, we do not have any positive cases in Tioga County, but yes, we have tested people, and we've sent those off. The results come back, and then we handle it appropriately from there. But I think we can talk a little bit more from the physician panel about the screening criteria that we use.
Yeah, and to piggyback with that, if you're in incubation, a test isn't going to do any good because it's not going to show up in the test at that point. Is that correct, doctors?
No, actually,
I'm wrong?
during the incubation phase, you can be shedding virus.
Okay.
So the actual target is to detect cases early on so we can quarantine and limit the spread of the disease.
So if you're in incubation and they do a test, will it show positive?
At some point in the disease process, you'll test positive.
Yes.
Is that your understanding?
Yes, it
Skip?
is. The amount of the virus that is in the system isn't necessarily indicative of positive or negative test. You can have a small amount of virus, and it would test positive based on the assay that's being done, the type of assay that's being done.
One of the things that's talked about in the spread of the disease and slowing this down is the viral shedding of asymptomatic carriers, early disease people. Those are the ones that are going to be very hard to target. Mm-hmm. Now, your question is, as Jim said, people are legitimately concerned, why aren't we just mass screening everybody? And the answer is simply because of a resource issue. We don't have enough tests to screen everybody randomly. Whoever wants it can get it. So this is a targeted strategy. And the criterion by which we're screening people is based on what the Centers for Disease Control, Atlanta, dictate. And the people who are really implementing the screening protocol is the health department, the state health department, in collaboration with the providers. So when we have a patient who appears to meet criteria, appears to be sick, has risk of exposure and the illness criteria, we then call a panel of specialists, in our case, the Wolf Center, Center for Infectious Disease, and we get a triage nurse who takes the data, and then it's run by a team of infectious disease specialists, and they say that individual does in fact meet criteria, and we're authorizing using one of our limited resource tests to go ahead and determine that. So it's very protocol driven, it's very expertly managed, and we all kind of know these are the rules by which we're flying. But is it ideal? No. The ideal is you have an unlimited number of tests and you can test everybody, but that's not the way it is.
Okay, well, that clarifies a lot right there. So the reason that more people are not being tested is simply a resource issue.
Mm-hmm. It is. It's not that it's not medically indicated, it's just that we can't screen everybody or we won't be able to screen anybody.
Yeah. Now,
I received a call today and then a letter from a lady that she heard somewhere, and it was documented by names, but supposedly there's a company in South Korea that can produce these test kits by the millions. And why aren't we getting them? Well, I didn't have a good answer for her, especially being a county commissioner. I don't procure stuff from overseas. Have either of the doctors heard of the South Korea protocol and their availability of test kits?
No, I've never heard of a company in South Korea who could easily manufacture these and solve our problem. I've not heard of that. What I do know is that we have the world's foremost experts in infectious disease. Dr. Fauci, the director of the National Institutes of Health, is spearheading this on the national level. You have to trust that they are addressing this problem. How quickly can we develop a diagnostic test that analyzes the presence of the DNA in the virus? That's how we detect the presence of the virus. This is a newly mutated virus. This virus didn't exist before this epidemic. So we've never encountered a coronavirus type 19 before. This is a newly mutated virus. So we don't have diagnostic tests for this. But when we saw the outbreak coming in China, that perhaps in retrospect should have been the time that we were ramping up the diagnostic tests to encounter a mass pandemic like this. So we can really blame public health directors, whatever. That isn't going to help us out of this problem. We need to use the diagnostic capability we have judiciously and try to control it and hope that we have the ability to ramp up the diagnostic tests very, very quickly. And the magnitude of a week or 2 weeks, we should hopefully, according to what the press is saying, have the various labs in our country ramping up the diagnostic capability.
one thing to keep in mind as well is that it's one thing to have a test, it's another thing to have a good test. If we're running a test, we want to make sure that the test is accurate. And if we're getting 1 million tests from who knows where, are they good tests? Are they going to be,
is the quality control
exactly
good?
And we know that the products that are being produced by the companies here, in the United States, they're going to be a quality product that I can trust.
They're reliable.
And something related to this that your viewers might be interested in is the whole idea of how do we design a vaccine and how do we design and create antiviral drugs to stop a viral epidemic like this. And what people need to understand is it's one thing to come up with the technology to design a vaccine or a drug that interferes with viral replication in the human body. But you have to test whether that's effective or not, whether it's safe or not, in what we call clinical trials. And these are trials where we try them on sick people, monitor and evaluate the efficacy, the safety, and then you manipulate things further. That takes months to years to really come to a conclusion that it's safe and it's efficacious, and the FDA then gives it approval.
And this is where a week or so ago when Dr. Fauci was pressed with that question, as to say, when are we going to have a vaccine? Because the word was out that vaccines were being worked on and what have you. And he was quite blunt about it. He says it's going to be 18 months to 2 years.
And it's the whole idea of you need clinical trials to prove these things before you can turn it loose on people.
Well, speaking of trials and them not being able to be tested, in the meantime, does being anxious or feeling a sense of panic, does that lower our own immune system so that we can fight something that's coming like this virus?
Yeah.
Well, I think that goes back to what Ed was saying about stress. Stress is a part of those things. Hopefully, these types of discussions where people can get facts, and not the first thing off the Google hit list, can help to lower that anxiety level. Looking at, reputable sources for information from the CDC, and National Institutes of Health, and like I say, our fall man, Dr. Fauci. These are reputable, solid places where people can go to get information that can help to relay some of those anxieties and fears. This is an anxious time for us because we don't know where we're going. Neither Ed nor myself have ever faced anything like this, in our careers. It's that's sometimes some of the worst times for folks in medicine is when you don't have the answer.
I would say that, like all things, an appropriate amount of anxiety will motivate us and really bring about a resolve to solve this problem collectively as a society, as a community. Too much anxiety will induce counterproductive behaviors, reactions, hoarding of supplies such that they're not available, etc. And we all know that, right? And I think the commissioner, and I really appreciate your efforts to say we have to reassure our people that we're working on this and that we will get through this together. There's no question we will. But is there grounds for anxiety right now? Absolutely.
Yeah.
This is uncharted waters for everybody.
Jim?
Yeah, there's been a lot of talk about testing through the last several minutes, and I understand that is very, very important. Where we were just 2 or 3 weeks ago as a country, we're moving at light speed with developing tests. We're getting more and more tests available in our region, and we're going to continue to replicate that very quickly, so we will have the ability to test people. But I can't understate, nothing replaces a clinician's diagnostic capabilities. And with this virus, it's very important to understand that, and I'm going to turn it over to our physicians here to talk about that. The symptoms are what we are treating, and that's why we're asking our patients to call in ahead of time so our physicians can diagnose this and do part of that social distancing and isolation protocols to perhaps prevent the virus from spreading or even ramping up further. So with that, I want to turn it over to the docs to talk about the not only the protocols, but that diagnostic tool that you use between your two ears. That's the most important tool you have.
Well, thank you, Jim, and I think both Ed and I would heartily agree with that, is that the test, any test, doesn't replace a physician's diagnostic skill, and both of us have had patients who we felt met all the criteria. We weren't able at that point to test for things, but instituted care based on where they are, not necessarily whether or not we could test them or not.
Exactly.
And that's, I think in the vast majority of situations, even going forward, that's how this is going to work. We're not going to have the ability to test everyone, nor will we actually be able to get the results back necessarily in a timely enough fashion to say, is that going to change how we're going to treat the patient? Old adage is, if it walks like a duck and talks like a duck, you got a duck, and that's how you treat it. So if someone meets the diagnostic criteria for this, you're going to go with that diagnosis until further notice.
Okay, very good. This next question has to do with point of entry. Can COVID-19 enter through a scratch, or your teeth, or your ear, or your eye?
I think the best answer to that question is that the virus is spread by respiratory droplet. So if you can get a respiratory droplet to somehow break the integrity of your body systems, yes.
But it's primarily
Really?
respiratorily ingested into
Yeah.
your body.
And
but,
the- and-
but it could go through any mucous membrane.
Precisely.
Essentially.
That's what I'm thinking.
Okay, this is one of those questions that's difficult. Okay, this is one of those questions that people think, but they're afraid to ask. And the question is, how do you die from COVID-19?
You die basically with respiratory failure. So the lungs become inflamed enough or infected enough that they no longer function. So you can die from complications of that, like pneumonia, but just the inflammation of a phenomenon known as ARDS, or adult respiratory distress syndrome. And that inflammation is enough so that even on a ventilator, you can die.
Dr. Guelig?
So your question is, how do people ultimately die from this infection? And you can think of death as coming from the absolute collapse and failure of one of our organ systems. And in this case, it's almost always, as Dr. Clark said, a respiratory cause of death. And the way the lungs fail is you have to think of what the lungs do for us. And they basically oxygenate our blood. So they take oxygen from the air and they get it to our tissues through the bloodstream. And they exhale our carbon dioxide, which is a metabolic byproduct of metabolism. When the lungs become so infected, though they can't perform those functions, we can try to compensate for that. We can supply very high concentrations of oxygen. And when the lungs are so stiff and so non-functioning that they cannot exhale carbon dioxide anymore, we can put a tube in the trachea and use a machine that generates pressures that inflates and deflates the lungs. But the point comes where even when we're mechanically moving the lungs, expanding and exhaling, they no longer exchange these gases, and the body can't survive without oxygen, and it can't survive with accumulating levels of carbon dioxide. So you have a system that fails, and with our medicines and with our machines, we can't sustain life.
And this is one of the reasons, what you just outlined, this is one of the big reasons why it's so difficult on older people.
That's exactly right, because that system fails sooner than in a young person.
Sarah, you got one?
If a friend calls you and they say, I have a sore throat today, but they're going to meet you tomorrow, do you kind of hesitate about that? Because it could be the flu, it could be something else, right? So do you stop that meeting from happening, or do you go ahead with that meeting? How cautious should you be with something like that?
Right now, you need to be cautious.
And I totally agree.
Right
with Dr.
now,
Clark.
you need to say, nope, we're not going to meet.
I might be coming down with something,
And-
better stay away.
Yeah. And,
I'll know in a few days if this is just a cold or if I'm really
Mhm.
getting sick.
you know, there's no social gathering that is that necessary. Pick up the phone. You know, we've held the task force that we've convened here for the county, all of our meetings have been held virtually. This is actually the first time that we've gotten together for anything, for that reason. You know, it's just not wise. Stay home.
Okay, this next question has to do with areas of surface transmission, like never letting someone use your phone. Question is about, like, when you go to get gas, when you're holding the gas nozzle, items in stores. Like if you go to the grocery store and you buy a bunch of stuff, you're picking stuff off the shelf that somebody may have touched. Would you address that, doctor?
Yes, we'd be happy to. So, using an analogy of the box of cereal that you may have purchased at the store, someone may have handled that box before you did. You don't know that. They could have coughed on the box. We know that the virus does live on surfaces for a period of time. It's variable depending on what kind of surface that is. So the things you need to do is protect yourself. So, if you're going to have something from that box of cereal, before you use your hands to ingest it, wash your hands. You pour your cereal into the bowl, put the milk on the cereal, etc., and before you pick the spoon up, wash your hands. When you leave the supermarket, use a hand sanitizer before you get in your car. Okay? When you go to the gas station to pump your gas, before you get back in your car, use a hand sanitizer. Clean your hands. This is the most common mode of transmission, not the only mode of transmission, is hand to mouth. And keep your hands off your face. You know, if you're in a situation where you can't do those things, don't put your hands on your face. Keep your hands out here, you know, until you can get to a place where you can wash your hands. Washing your hands with soap and water, the CDC has said multiple times, is the most effective way of keeping yourself safe. The hand sanitizers work, but the soap and water is by far the best. 20 seconds, do the birthday thing twice, I don't know, other ones, you know, those kinds of things. But that's the best way. And then keep your hands off yourself.
Jim, you want to wrap this up for us?
Yeah, John, and we really appreciate the opportunity to come here, speak to the county, speak to all your viewers. The importance of this can't be understated. We're not at the level of panicking this county. The commissioners acted very quickly, as I said earlier, with that declaration. We quickly assembled this task force, and we're advising the commissioners on a daily basis. But a few key takeaways we can't understate. The social distancing is very important. We have to adhere to that. The doctors tonight addressed all the questions as detailed as they could, but the key takeaway is we have to distance ourselves socially until we can get a handle on this as a country. And if you haven't heard it enough, you have to wash your hands multiple times a day. Everybody here sitting in this panel can attest our skin is starting to break down on our hands now because we wash them so frequently. So we're quickly going through hand lotion as quick as we are with hand sanitizers. You have to wash your hands multiple times a day. If you touch a surface outside your home, at a grocery store, at a gas station, anywhere, you have to clean your hands appropriately. You have to wash your hands for 20 seconds, and we have to adhere to that social distancing. But I can tell you our county is prepared for this. We're taking steps every day. We're taking measures every day to make sure that Tioga County is prepared. The commissioners are doing a phenomenal job to make sure we're on the cutting edge of the new technologies as they come out, the testing capabilities, and the health systems are prepared to respond for this if and when we have a case in Tioga County.
Roger?
Thank you, John, and thank you to the Homepage Network for hosting this tonight. And a special thank you to our panel, the doctors, and to Jim. I know this is your second trip here today. You've been a busy man, and I appreciate all the efforts of everybody bringing this all together. Thank you.
Thank you, Roger. The Homepage Network has set up a site resource that you can reach, and it's located on the top right area of all of our products. Now that includes Wellsboro homepage, Mansfield homepage, Blossburg homepage, and Homepage Sports. Each day we will be publishing regional COVID-19 updates and also broadcast information to help you and your family navigate these challenging times. You will also find important links and resources to help answer all your COVID-19 questions. Down the left navigation bar, you'll find a number of channels from community leaders, like regional medical facilities, for example, Laurel Health Centers. You'll also find a channel from the Tioga County Commissioners, the Police Department with Chief Jim Bodine. Representative Clint Owlett will also have a channel there. You can go to these channels for the latest information posted from each one of their offices. Once again, we want to thank Commissioner Roger Bunn, the doctors who participated today, Jim Nobles for helping to facilitate this program, our community leaders who are fighting so hard to protect us. Now remember, stay calm, be encouraged, encourage others, pray. I do believe in the power of prayer. Trust in the Lord to get us through this season. Do not fear. Do not lose your sense of humor. Love each other deeply from the heart. And last but not least, wash your hands.